what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. Let's go. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, XL, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go.
These brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.
Hello, everybody. Welcome. I want to talk to you tonight about kidney advocates and kidney advocacy and our guest. I've known in my lifetime a handful of great kidney advocates. The great Bill Murray, who was invited to speak at the White House twice. The great Bill Hahn, who took his footprints in the sand and turned it into a 2-day National Kidney Foundation event for transplant moms and their children. The great Kent Bressler, who's been on our show twice and is on his way back a third time, that is helping people get preemptive transplants, transplants before dialysis, and our guest tonight. So a little bit about kidney advocates. Most of us come from a place of anger sometimes bordering on rage. Things have happened to us as an adult, and we don't want those things to happen to anyone else. So that's how we become advocates. Please do not paint my guest tonight with that brush. Let me repeat that. Please do not paint my guest tonight with that dark brush. She comes from a totally different place. She comes from a place of love and caring and enthusiasm, and it's almost spiritual. I mean, she makes you feel uplifted. She makes you feel good. This is her strength. This is her gift. This is why she is great. Because whether she's speaking or at a webinar, or she's talking in public, or she's writing, or she's blogging, or she's posting on social media, when you see those things and you see her, you just feel good. You feel great. And that is her greatness. Her real and true secret is this. In her lifetime, even as a child, she has had huge, huge obstacles in her path, huge kidney obstacles. And she has overcome them with aplomb. And that, ladies and gentlemen, is what makes her great, because it makes us feel like our kidney problems are small. Our kidney problems are insignificant, and that we can overcome our kidney problems because of her example. My friend, the great Lisa Baxter, who's with us tonight, my friend Lisa Baxter frequently says to me, Jim, you only have kidney royalty on your show. Well, Lisa, get ready, because the queen is with us tonight. The great Valen Kiefer is here. All right, Steve, let's talk to Valen. Hi, Ms. Fallon. How are you?
Hi, Jim. I'm wonderful. How are you? I'm over here wiping tears. That was like the most heartfelt, beautiful introduction. I'm so touched. You should have warned me to bring tissues.
Oh, well, maybe next time.
Thank you, Jim. Really, I'm very touched by that.
Well, you're the greatest. I'm so pleased to have you on. You've been one of my heroes. I don't know for how long. A great heroine. So let's get right into it. Before we start, I want to let everybody know there are links, there are photographs, there are links to Valen's website. There's a placard with all of her accomplishments and her awards. All those things are in the comments to tonight's broadcast. So you can check those things out there and follow along with us as we're talking. Miss Valen, tell us a little bit about where you grew up in your childhood, what it was like.
Sure. I currently live in Northern California, but I grew up in York, Pennsylvania, and I had a wonderful childhood and have incredible parents, but I started to be affected by health issues in my youth, and that journey began actually when I was 5 years old, when I had my first grand mal seizure, but kidney disease came into my life when I was 10 years old.
Okay. I understand that you have been a polycystic kidney disease patient for over 32 years now. Can you tell our audience, for the people that aren't in the know, what is polycystic kidney disease? What's it been like for you?
Sure, and I love your t-shirt. Yes, and BAD. So polycystic kidney disease is one of the most common life-threatening genetic diseases, and I side of the family, and I was diagnosed when I was 10 years old and had severe issues with it in middle school and high school. With this disease, your kidneys can grow to the size of footballs. They have multiple cysts and can cover them. And for me, mine were huge, polluted with cysts, and I was in and out of the hospital a lot with cyst bleeds. And then the really challenging journey, if that wasn't already challenging enough, started when I was 18 years old, when I was admitted to the hospital and almost spent a year in the hospital at that time.
Okay. Can you describe for us the circumstances that led your parents to seek care for you and the steps they took to diagnose you as PKD, which hospital, all that sort of thing?
Sure. So I actually, when I was 10 years old, just went to a normal pediatrician appointment, and I had sky high blood pressure of 160 over 140, which is just insane for a little child. And with my mom having polycystic kidney disease and knowing that it is hereditary, and that high blood pressure can come from polycystic kidney disease, she had an idea of what it could be, and I wasn't aware of it at the time, but my doctor was, and they sent me for an immediate ultrasound and saw that I had cysts all over both of my kidneys. And at that time, I was diagnosed with PKD, put on blood pressure medicine to control my blood pressure, and still to this day, I have to take blood pressure medicine.
Okay. Can you tell us, you mentioned you were 10 years old, you were in grade school, you were in middle school, you were in high school. How did this affect your schooling and your personal life? How did you feel at that time?
Well, for me, we didn't even talk about it a lot in our family, and I didn't know anyone else that had the disease besides family members. So for me, during middle school and high school, I felt quite different. And with the enlarged kidneys, they can be so sensitive that if you bump into something or get hit playing a sport, that you can have cyst ruptures. So for me, I couldn't participate in sports and a lot of things in gym class, and had to sit on the sidelines and look different. So my youth, I just felt at the time, I thought I was just kind of the only one that had this disease, even though I know other family members did. But it was really hard to not have any type of support or other people around my age to talk to. And that is a big driving force of why I'm really passionate about sharing my story and helping others so that they don't feel alone like I did.
Okay. One of the big themes that I've seen in your work, and I've tried to read everything that you've ever written as best I can the last couple of months. One of the big themes that I see is that a big part of your work is to let PKD kidney patients, transplant patients, parents of pediatric kidney patients know that they are not alone and there are resources. Can you talk to us a little bit about that?
Yes, because if I think back to when I was in the hospital and found out I had to start dialysis and needed a transplant, there wasn't resources provided to us, and there weren't support groups and people that we could talk to. So for me, that was really a drive to provide that for others. And I started to do that in my early 20s after my kidney transplant, with starting a local chapter for polycystic kidney disease and providing that community, creating it in my hometown of York, Pennsylvania. And that kind of was the starting point of really getting involved and helping other people and finding my passion of using my firsthand experiences to hopefully help create positive change for people today and future generations.
Okay. I read that you spent most of your childhood or much of your childhood in the hospital with cystic bleeds. And at the age of 18, 8 full years after your original diagnosis, you spent almost a full year between 18 and 19 consecutively in the hospital. Can you tell us what was that like? What happened?
It was so scary, and there are so many days, thankfully, that I don't remember because I was that sick. But what happened is I graduated from high school. I actually missed the first half of my senior year because of being in the hospital and cyst bleeds, and I had pancreatitis, but I graduated on time, started college, and a couple of months into college, I just fell to my knees in kidney pain, knew it was a cyst bleed, went into the hospital, and that was the start of the really long journey. And my cysts kept bleeding, and they couldn't control them, and tried to do different operations. I wound up receiving over 70 blood transfusions to try and compensate. And I was at a hospital for about 3 months, and they weren't really sure what to do and just kind of shrugged their shoulders. And that wasn't, of course, okay for my parents. And they reached out to Johns Hopkins in Baltimore, Maryland. And I was so sick that they were concerned I wasn't going to make it to be transported, and took the risk of doing that. Went to Johns Hopkins, kind of had to start fresh of all the tests and everything. And it wound up that they made the difficult but necessary decision to remove both of my kidneys, even though my kidneys were working at 60%. But they would have killed me if they kept them in because of the bleeds. And at that point, I was put on immediate dialysis. Sometimes had to endure it daily because of the toxins that I had. And I was too sick to be placed on the transplant waiting list, but needed a kidney to survive. So I needed a living donor. And I was the back then it was I was so sick. Both my parents were living in the Ronald McDonald House. I was that teenager that you just didn't expect to make it. And it's just amazing that now, almost 20 years later, I'm alive today and doing so well.
You mentioned your parents. I want to talk to you for a minute about that. Tell us about the support and love that you get from your parents, how they helped you through your childhood and continue to serve you as an adult, because this is another theme that I see quite a bit in your writing and your speaking.
Well, I think we all know going through any challenges in life, it is so hard to do it without support, to have love and know you have something to fight for, something to look forward to. And my parents gifted me with that through my entire youth and even to this day, showing me unconditional love. And I've been fortunate to have Noah, my husband, who is just amazing and providing unconditional love and support. And it's so hard to be in the hospital day in and day out and wait for a life-saving transplant. And it's hard to see what that puts on our support system, the stress, but they're invaluable. And for me, it's just, I think it's important to talk about caregivers and for them also to have support as well, because this is a really hard journey. But I know I couldn't have made it without my parents. And then now today, I can't imagine my life without Noah.
You suffered from pancreatitis. You were fed through a PICC line. You had congenital bleeding vessel in your stomach. You were on daily dialysis. You were in ICU. You had surgery. Your family at points in time said goodbye. These things all kind of combined to make you too sick to be placed on the transplant list. Mm-hmm. What got you through? How did you deal with all this?
It's just wild when you list it out. It's really hard to believe. I think it exemplifies our resilience, physically, mentally, and the miracle of transplantation. But yes, when you're in the hospital and you're sick, it almost feels like the longer you're in there, the more things can happen and just pile on top of one another. And I mean, I was enduring pancreatitis and fed by a PICC line and couldn't eat or drink for 6 months. And that was during the time that both kidneys were removed and I was on dialysis. I mean, I was just deathly ill. And when I had that bleeding vessel in my stomach, that's when I needed emergency surgery. And I was in the ICU. And like you said, they called my family down to just prepare them and say their goodbyes if I didn't make it through that surgery. I think my mental resilience at that time really helped me, because I remember I didn't think about dying at that time. I didn't ask about it, didn't talk about it, didn't think about it going into that surgery, but I definitely knew when my ICU room was full of loved ones that prognosis wasn't good. It's just one day at a time, sometimes 1 minute at a time when you're that sick. And sometimes so much is going on that you don't even have the mental capacity to even think deeply and really truly understand how scary things are. I know my mom said that at the Ronald McDonald House, there would be parents that would come back. They became connected and friends with people there. And it was just really sad, the parents that would come back and have lost their child that day. And she just wondered if that would be my parents someday. And I just can't imagine what they went through at that time and what they had to witness me go through. And being too ill to be put on the transplant waiting list was really scary, because we needed somebody to step forward and be my living donor. But it wasn't just even that. I needed a doctor that was willing to take the risk to transplant me. And I was fortunate to have Dr. Robert Montgomery be willing to do that because he didn't want to see a, at the time, 18, 19-year-old young girl die. So him taking the risk and my living donor stepping forward and the support of my parents just carried me through.
Okay. You were diagnosed at the age of 10 with kidney problems. You were transplanted when you were 19 with a kidney. You were transplanted again at 35 with the liver. Talk to us a little bit about getting on the transplant list the first time for the kidney, because we know there was a gap and we know that there were issues. How was it that you ended up on the list?
Well, for my kidney, I never made it on the list. It was because of my living donor, Sally, stepping forward, and I had several people that were kind to get tested for me, and she wound up being a good match. So for that transplant journey, I never experienced the wait list, but I did have to go through that several years ago with needing a liver transplant because of polycystic kidney disease.
Okay. At the age of 19, you received a kidney transplant on August 13th, 2002 at Johns Hopkins. And as you mentioned, the great Dr. Robert Montgomery, who, by the way, just so people know, this guy is like, way up here, okay, in terms of kidney docs. You recently celebrated your 18th kidney anniversary, and your friend's mom your mom's friend from the 8th grade, Sally Robertson, actually donated to you. That's really something. Can you tell us what it was like to be transplanted? How did that happen, and how did you feel?
Well, I remember it was a good friend of mine from high school's mother, Sally. I've known her since 8th grade, and she stepped forward and got tested. And I remember I was sitting at my parents' house at the time when she called and told me the news, and it just felt like this huge weight was lifted off of my shoulders, and it was hard to believe that I was at that point in this journey. And I just feel like that was the missing piece that I needed, because after I received my kidney transplant, it's like all of those other issues just seemed to resolve. And it was, a little bit of a longer recovery because of going into it so sick, but it was just amazing, this new life and how much better I felt. And then just allowing me to grow into the woman that I am today is just, it's really hard to believe. This August, I'll be celebrating 19 years with my kidney transplant, and I would have never fathomed it. I mean, my life has been almost doubled because of Sally's decision to save my life.
And we hope other people make that same decision for some of our friends that are on the waiting list. As an immunosuppressed kidney transplant patient, describe the challenges that you faced over the next decade or so.
Well, I think in the beginning, I was recovering from so much that it just took some time for my body to heal. And then, like all of us are, transplant recipients, when your immune system is really suppressed in the beginning, you can get sick easy. So I remember I tried to return back to work and kept getting sick often. So I needed a little bit more time for healing. But I'd probably say after the first year is when things started to settle down. And at that time, I was in my early 20s. I started working full time. That's when I started volunteering and learning of my passion. And it was incredible for many years until I got sick again with my liver issues.
Okay. In the fall of 2016, your health took another unexpected turn. Sepsis, tremors, fever, abdominal pain. Your PKD was causing your bile duct to malfunction with von Meyerberg's complexes, liver infection, and the need for a new liver. And another one of these deals where, you either get a liver or you pass away. Can you tell us a little bit about that?
Yeah, we were just devastated by it. I mean, I know PKD can affect more than just your kidneys, but I never had any cysts on my liver, didn't think that there were any issues with it. And I was healthy and doing so well. And then all of a sudden just started to get really sick again. And like you said, I had sepsis episodes just one after another. It would be like every 6 months, and then they would get closer together. And next thing I knew, I was on daily IV antibiotics and a port, and even taking oral antibiotics at the same time to try and suppress these infections. And it was a long road to discovering that it was actually my liver causing it, but a PET scan lit up my liver and led us down the path to determining that it was polycystic kidney disease that was affecting my liver. And now in my mid 30s, here I was needing another transplant, this time another organ. And we kind of thought PKD sort of behind me. I had both kidneys out, got a transplant. I knew I'd have health hiccups with that, but the thought of a second transplant and another organ was just really scary. And like you said, with a kidney transplant, you have this bridge to carry you through. You have dialysis as you wait. With a liver, you don't have that. And that perspective for me was really scary, that if I didn't get a new liver, I could pass away. And I honestly had thoughts of how much could one body handle. I was getting really sick where I remember I was so exhausted that I'd have conversations with Noah, and like if he'd ask me a question or we're talking, I felt like too tired to even just engage in conversation. And I was really scared, just wondering with the next infection, would I pass away with the next sepsis infection? And uh, going through the whole transplant wait list was just really uncertain times, and I didn't know what the future looked like. Would I get a transplant? What would life be like after a liver transplant? And then once again, I sit here super lucky because this August, the same month that I'm celebrating 19 years for my kidney transplant, I'm going to celebrate 3 years with my liver transplant. And I just feel really lucky to have received a miracle twice in life. I thought once was extraordinary, and twice just feels overwhelming.
Your doctors in California thought that it would be too long a wait for your liver. So on August 4th, 2018, you were transplanted at Barnes in St. Louis, Missouri, a liver transplant from a deceased donor. Can you tell us a little bit about that? What happened in that regard?
Sure. So I got on the wait list here in Northern California, but they thought the wait would probably be a year and a half, and they didn't think I'd survive that long. So they suggested that I got dual listed at another center, and they suggested the Midwest at Barnes Jewish Hospital. And oh my goodness, I thought just that seemed so overwhelming. And we did it. And thanks to Noah's support, we went there, went through transplant evaluation, and I wound up being number one for my blood group at Barnes Jewish, and we temporarily relocated. And we're really fortunate that because of me being number one on the list, once we arrived in St. Louis, we only had to wait 1 week and got the call for a liver. And all of it went so smoothly. And I thought to myself, my body has been through so much, already has a kidney transplant, so many surgeries. What's it going to look like for a liver transplant? How am I going to endure it? Will complications happen with so many abdominal surgeries? And it went far better than we could have ever dreamed of.
How has your health been since the liver transplant? Have you had other issues or not?
I recovered really well. We actually, 6 weeks after receiving the transplant, we were flying back home to Northern California, which just seemed impossible pre-transplant. And it was amazing to think 6 weeks after transplant, I'm walking through the airport and we're flying home. Just was miraculous. And I mean, you go through the adjustments in the beginning with your transplant meds and everything like that, and you still even go through it today, many years later, and you have all of the precautionary things that you have to do with not getting sick, with being on immunosuppressant meds and all of that. But overall, recovery went really smoothly. So transplant-wise, my health is really stable. I do have a scoliosis and have a lot of back issues. So for me, that's actually a constant daily issue. But transplant-wise, my health has been really stable.
Okay, and scoliosis is something that's been with you since middle school, if I remember correctly.
Yes,
Is that
yeah.
right?
Yep. When I was in middle school, I had really bad scoliosis, curvature of my spine, and I had two rods placed on either side of my spine from T3 to L2, so down the majority of my back, and I only have 4 discs below the rods. So I have dealt with a lot of issues, and in my early 30s had a disc herniate and deal with chronic pain and a lot from that. So actually my back is daily maintenance and takes a lot of work, even more so than my transplants. And but
Okay.
yeah.
How do you do it, Valen? How do you maintain such a positive California sunshiny attitude in light of all the things that have happened to you? Explain to us how you do
Oh, I'm not sure if some of it is just a bit of a predisposition of optimism and being positive, but I think that there's also choice and a lot of work in it as well. I think I choose to be grateful. I choose to be a really good advocate for myself and take the best care of myself, like for my back in order to live the best quality of life. It takes a lot of daily maintenance and work for that, where when you're a patient, if you don't put that in, you're likely not going to be as healthy as you could be. So I also think the love and support that surrounds me, people like yourself that lift me up in the community when I share my story, that is huge. I feel so lucky for our incredible community and circle of support. And of course, my parents and Noah. So I think the love that I've been surrounded with has really helped me. And I choose to be grateful. I choose to shift any fear to gratitude because the other option just wouldn't be an enjoyable life. And I think, I mean, I have never been bitter about the diagnosis or having all of this. You know, I've chosen to make the best of it. And even though it has been extraordinarily challenging, it's been extraordinarily beautiful as well. There have been amazing experiences gifted to me because of what I have gone through. And also I think finding my purpose of sharing my story and using my firsthand experiences gives purpose to the pain. So I think if I didn't have this passion of being a patient advocate, I also think life would be difficult too. It's really therapeutic for me to be able to help other people and to see that what I've gone through is of benefit to others and it's helping them on their journey. I think all of that combined together helps me stay positive.
Excellent. Tell us a little bit about when you started to advocate for others. It's my understanding you've been doing this for over 16 years. Was there some event, something that happened, something that triggered you to take on this responsibility to advocate for your fellow kidney patients, your fellow PKD patients, solid organ transplant patients? I know you cover a big map.
I think
Why do you do it?
it's been really neat how it's evolved. It's been a beautiful journey of one thing leading to the next. I I at my first job after my kidney transplant, I remember I literally sat there and was like, I wonder if there's anything out there for PKD. And I just typed in on my work computer polycystic kidney disease, and the PKD Foundation came up. And I called them and shared my story, and they said, I think you'd be great to start a local chapter. So at the time was living in an apartment, and I remember sitting on the floor in my early 20s. They gave me a list of people in York County, Pennsylvania that were on their mailing list. And I literally cold called them and said, hi, my name's Valen. I'm thinking of starting a support group. Would you want to join? And I got people's contact information and I set up my first meeting. And I remember standing there and I'm like, is that door going to open and is anybody going to come through? And I remember it was Carolyn Stone was the first person that opened the door, and I was like, somebody's here. And it wound up being amazing. People from the community came. I started a support group. Then it grew to a local chapter. And then I organized 3 fundraising walks. And then I did a kidney education seminar. And then all of a sudden, I started sharing my story. The PKD Foundation asked if I would come to one of their conferences and share my story. And I never did it before. And I was like, well, sure. They're like, just, come share your story. Not a big deal. And I remember I opened the doors and it was like the whole room was full of a couple hundred people. And I thought, I'm going to know whether I like this or not. And I walked up and I shared my story, and I was in awe by who came up to me afterwards and what they said. And I think that's the moment I realized that I really wanted to get out there and be a voice in the community, because it's amazing when you share your story, how people connect to it, how it touches them, what they do with that. And at that moment was, I think, really insightful for me and really gave me the fuel to share my journey. And the neat thing is it's just been one event after another. It's happened very organically, where I'll be at an event, somebody will be there and have another opportunity, and it'll go from there. And even my writing, I didn't write before. And there's a friend of mine that used to work at the PKD Foundation, Dave Switzer, and he's like, I think you should write a blog for us. And I was like, I remember I was hesitant for several months because I was like, I never wrote before. And he's like, just, try it out. So I started writing, found out that I absolutely love writing, and like 250 blogs later, now it's a big passion of mine. And I think the whole thing with it, whether speaking or writing, I have just done both from my heart. And I think just being your true self is the best gift that you can give yourself and others. And I think that that's why one thing has just led to the next. And it's been amazing how it has grown from the PKD community to the kidney community as a whole to organ donation. And then I think my story of resilience can impact people even outside of our communities. I think anybody going through any challenge, and it's been, I'm just overwhelmed by it. And it's like I almost just am enjoying the ride myself. I'm like, okay, what will come next? And I'm just excited for the future.
Well, my friend Valen is so modest. When you talk about raising money for the PKD Foundation, Valen, you have raised over $1 million for the PKD Foundation. So I want people to know that.
Yeah. Thank you.
Let's talk a little bit about some of your current activities. What's going on with the National Kidney Foundation? I understand that you're a member of CAC now.
Yes, I know. I'm excited. And that actually started because I know you know Kelly Collins, and we were both asked to speak at an event with Otsuka for mental health in the kidney community. And that's how I met her. And she's delightful. And then after meeting and sharing my story, she brought me on board. So I'm really excited. And the National Kidney Foundation has been really nice with sharing my story. And I'm looking forward to future collaborations with them. But that was another very authentic happening of just meeting Kelly through another event, and then it led to something next. That's what's beautiful about this life.
So I hope someday that you and I are at the same NKF Kidney Summit and we can get a picture together. That'd be fun.
I would love that.
Do that. Talk to us a little bit about this recent article with Transplant Nation. They did such a wonderful job and took so many great photographs. What was that all about?
I thought so too. I had connected with them because I saw an ad for their magazine, actually, in the Renal Support Network magazine. You know how our communities are all connected. And I saw their magazine and thought it was really wonderful and had connected with them. And then they had asked about sharing my journey, and it was a beautiful process. The questions that they asked me, I was so impressed. Very deep, thoughtful questions. And they put together a really remarkable piece of it's a lot medically and advocacy, and to try and put it all into one package. And I thought they did just a really extraordinary job with that. I'm grateful to them.
You know, we were set to talk in January, and things came up, and that conversation fell through. And here we are in April, and I noticed that there are a couple of things going on with you recently since we were scheduled to talk last. One of those things was the Bounce Back, Give Back webinar and the award from the Chris Klug Foundation and the YouTube video, April 13th, 2021. Can you tell us a little bit about that? That's real recent.
Sure. I love the Chris Klug Foundation. I do a lot of work with them, patient panels, and a webinar, and also spoke at an event with them. And they're an amazing organization in Aspen, Colorado. And several years ago, they awarded me with the Bounce Back Give Back Award. So it's something they give every year to 2 transplant recipients that have bounced back from receiving transplants, but not only are doing that, but are contributing and giving back to their communities. And it was a really special event to be a part of, and was honored to receive the award. received it on top of Aspen Mountain, which was just amazing. They do an annual event called Summit for Life, and it was amazing for Noah and I to be able to participate and be there. And so recently they had nominations open. They actually just closed them, which is a bummer, now that we're talking about it. But so they were opening nominations and had a webinar inviting back previous award recipients to talk about their experience. So it was really fun to relive it, actually.
Cool. I also noticed recently that you partook in the Johns Hopkins COVID antibody study, where they were taking a blood sample before the first vax, a blood sample after the first vax, a blood sample after the last vax. Can you tell us about your experiences with that?
Yes, I'm glad you asked about this. I am so fascinated about this study. I'm really grateful to be a part of it. So right now with transplant recipients getting the vaccine, we're not building up the same antibody response as general population. So after the first dose of transplant recipients that they tested in the study, only 17% showed positive for antibodies, where during the trials outside the general population, it was 100% showed an antibody response. So that's a really scary difference of numbers, meaning that transplant recipients that are getting the vaccine doesn't mean that they're being protected, and shows that we need to continue to be careful. And this is really important for us to not only find out these results, which are then figure out how do we move forward from this. Okay, we learned this, but how do we get transplant recipients protected? So is that going to be a third booster shot, or what's that going to look like in the future? So that's what Johns Hopkins, that's what the study's about, and that's what they're working on. And of course, I have my full trust and love them. I received my kidney transplant there, and so it's been really wonderful to be a part of it. So with the study, you took a blood sample before you got the first dose, and then a blood sample a month after the first dose of the vaccine to see if you build up antibodies. And then you do another blood sample a month after the second dose to see your antibody response from that. And it's showing things like a lot of transplant recipients who are on CellCept. That seems to be a big issue. The anti-rejection medicine CellCept is making it that it seems like if you take that, oh no, makes it that you can't, that you're not building up as good of an antibody response. So are you a part of the study?
I applied, but they told me it was too late. So I was not fortunate enough to get on board there. The Dreamwalk fashion show. You have 60 some odd inches of scars on your body. And I understand you designed your own costume. You put glitter on your scars to highlight them. The idea was about body acceptance and scar acceptance. Can you tell us a little bit about that experience?
Oh my gosh, that was so fun. It's like, take us back to pre-COVID life, right? That was in the fall of 2019. And it's called the Dreamwalk fashion show. And like you said, it's about body positivity. And they have about 60 dreamers, they call them, that walk the runway. And the fun thing is it's kind of, the costumes are sort of like a Victoria's Secret with wings and everything. But the people, the dreamers that are walking the runway, are people that have endured a lot in their life, have overcome adversity, and are using it to help others. And I felt so lucky to be selected to be a part of this fashion show. And it was in New York City. And I worked with some designers here in Sacramento, California, to create a costume that would show the majority of my scars. And like you said, I have 60 inches of scars. And, they blend in a bit with your skin, that if somebody's far off, they might not see the impact of it. So I thought, okay, I'll highlight them with glitter. So highlighted them with glitter and walked the runway. And I just really wanted to share my story in a different way. I've shared my story at over 100 events across North America. And I thought, I have an opportunity to walk the runway. How can I do it differently? And I thought of my younger self, who didn't like to change in gym class because didn't want people to see my scars. And I thought, I'm going to make that little girl proud and do something different that I never would have thought I would have done. So here I thought I was going to do it to help others. And it was actually really inspiring personally to do that, and just very liberating to be on a stage in a room full of people and displaying what I've gone through, but the beauty of it. And I think it was actually just really impactful for not only others, but also myself.
Excellent, excellent. You also spoke. You mentioned the Osaka, Canada pharmaceutical. There was a gala there celebrating the first treatment for PKD released in Canada. You spoke at that event. Can you tell us a little bit about that?
Oh my gosh, you're bringing back so many good memories. Thank you for this. I felt so lucky. So, growing up with polycystic kidney disease, having many family members who passed away from it, I just wanted to live to see the day a treatment or cure would be found. I just thought that would be remarkable. And then to have a treatment found first in Canada before it was approved in the United States. And then I was asked to speak at the gala celebrating a treatment, being discovered and in Canada was just amazing. And so I was very fortunate to be invited by Otsuka Canada and to share my story at the gala. And it was just incredible to be able to think of my grandma who passed away and I never met, to think of my mom who has the disease, and my brother, and plenty of family members that I never met because they passed from this disease. And to think that I was standing there representing our community on the night of celebration of the first treatment for PKD was just mind blowing. That is something that I will carry with me the rest of my life. The honor of that was just amazing.
You mentioned your writing. You wrote an essay for the Astellas contest about how transportation changed your life, and you won. And you ended up in the Rose Parade on the Donate Life float. Can you tell us what it's like to be in the Rose Parade, Miss Ballard?
Sure. I feel like you said, the California sun. I'm like continuing to move back because it's setting. So I'm sorry about the sun. Yes. So when we moved around like 11 years ago from Pennsylvania to California, and at that time I was really active. I was doing a lot of public speaking in Pennsylvania, all of the work that I shared with the support group and the chapter. And I thought to myself, like, I'm leaving this, how am I going to rebuild this in California? And it concerned me a little bit. And when we moved, I saw the contest and I thought I'll write about how my life has been, of course, greatly impacted by transplantation. And here I was selected as the winner. And like you said, I won the opportunity to ride on the Donate Life float in the Rose Parade. And that was January 1st of the first New Year's that we were in California. And here I thought, I was concerned about not being active in organ donation and trying to connect with others moving to across the United States. And here I was waving to people on national TV, and it was just an opportunity and ride of a lifetime just to be able to represent and have that platform and that experience. And kind of like I said earlier, it's been really challenging, but these experiences that we're talking about are just ones that I would have never had if it wasn't for what I went through. So when you put it into that perspective, I think it is replacing those challenging days with extraordinary moments that just keep me fighting and moving forward.
The Garden of Life Gala advocacy at Jewish Barnes Hospital a year and a half after your liver transplant. Can you tell us a little bit about that?
Oh my gosh, that was the last big speaking event in person before COVID. I'm holding on to those memories. So a year and a half after I received my liver transplant at Barnes Jewish Hospital, they had a gala to celebrate them reaching the milestone of performing 10,000 transplants at the center. And they asked me to share my story on that stage. And it was a fairy tale evening, one that when you think big picture of everything, it's really hard to believe. I thought a year and a half earlier, I didn't even know if I'd survive. And then there I was, healthy and well and post-transplant, and now representing the 10,000 transplant recipients at that center. And here I was in California thinking, how can we possibly go to Barnes Jewish Hospital and how would that work and relocate. And then having such a moment like that was just very surreal and just incredible to think that I was gifted that chance to stand there and express the gratitude of the transplant community as a whole for the work of Barnes Jewish Hospital and the surgeons and the whole team. I mean, it was a room full of several hundred people that had a huge impact in the field of transplantation. And I just was pinching myself on how I had the opportunity to stand before them and thank them. And it was really special to have my liver transplant surgeon there and my hepatologist there. And during my speech, to be able to literally look them in their eyes and thank them at that type of an event was just something that I know I'm very fortunate to have been able to do.
Okay, I wanted to point out to the group the things that we've been talking about, your webinars, your writings, etc. You have a website, www.valenkiefer.com, and all of this information is on the website, so they can access it, including the things that you've done that we've spoken about today.
Thank you.
I'll tell you the one story that intrigues me. What is this story about robot face Valen and CareDx over in Brisbane, California? What was going on there?
So that was a fun experience during COVID. I mean, I was on just a high thinking right before COVID, was speaking at Barnes Jewish Hospital, and then to have that all stop and just wonder what life would be like. But it has been amazing during COVID thanks to technology and being able to do things virtually. And I had a really special experience that was taking the virtual to the next step of where CareDx opened a lab here in California, and they had me share my story at the ribbon cutting of the lab. And there were a few of the employees there, but of course, since it wouldn't be safe for me to go, they had me be a robot there. So they had a robot where it was basically like almost like an iPad on a moving pole type thing, and I was on the screen. So there's pictures of the people at the ribbon cutting and then a robot in my face. And it was just so much fun. I think it was really great that they did that because it helped me feel a bit more connected and actually there, which was just really lovely at a time when it was, it's hard to be home and missing that human connection with people.
Okay. What's next that you can talk to us about for Valen Kiefer and her advocacy? Do you have events on the calendar that are coming up that you can tell us a little bit about?
I definitely have projects that I'm working on. I'm trying to think of the next actual event. I don't know if I have anything scheduled in the next couple weeks, which is, I know whenever I say this, I will get an email. But most recently, something that I did, which was really special, is the National Academies of Science, Medicine, and Engineering had reached out to me, and they did a workshop for the Social Security Administration on the state of the science of organ transplantation. And they asked me to be a panelist and share my story. And I thought that that was just really incredible and meant a lot to me because Social Security Administration reached out to them and wanted more information on organ transplantation in order to be able to understand it a bit better for people that are seeking benefits. And it meant a lot to be able to hopefully help those in the future that need benefits and giving them the full picture of what it's like to receive a transplant and the complexities of it and how everybody is different. One isn't the same as far as the journey of the onset and recovery and all of that. So that was something recently that was really a big project that I worked on and very important.
I have been reading that you and your husband Noah have been traveling around in an RV, a motorhome, to keep you safe and to continue your advocacy. Can you tell us a little bit about the adventures in the motorhome?
Well, I think it was really hard to be the healthiest I've been in years and then have to stay at home like I did back when I was sick for years. It's like, okay, I've been given this second chance at life and I'm really healthy and now I can't go anywhere. And for us, we wanted a way to have a safe way to get out in nature, which we love, and continue to feel like we're making the most of this gift that I've been given. And so for us, we decided to get an RV and be able to just have short trips that are then easy for my back too, because it's hard to travel with my back. So it gives us a safe bubble, more comfort that we can get out. And it's just been really nice to be able to feel like we can do something during this challenging time.
All right. We're in the home stretch here, Miss Valley. Is there anything that I failed to discuss with you tonight that you wish to add to our discussion? Is there anything that you wish to say to the people in our audience?
I'm just really grateful for you taking the time to learn about my story, and your support over the years means a lot to me. So I appreciate this platform to share it. And like we talked about, I think it's wonderful. I appreciate you sharing my website for people that want to learn more and to see past advocacy efforts and events that are coming up in the future. They can go to my website at valenkeeper.com. And also I'm open to anyone reaching out if they have an opportunity for patient story or insight or anything. I'm would love to hear from anyone.
That's great. That's great. Valen, I've never met you in person, but I've always admired you from afar, and I hope someday that I get to be in the same room with the great Valen Keeper.
Thank you, Jim. I hope so too.
Thank you so much for coming on and talking to us tonight. It's much appreciated. Just to give people a preview of what's happening next on Kidney Stories. Next Friday, we're talking to Dr. Ken Suthra, who is not only a medical doctor, but he's a PhD, and he's also a kidney research associate from Stanford. He does a lot of work with the AKF, and he was on broadcast elsewhere tonight. So that should be an interesting show. We're going to talk to the head pediatric kidney surgeon from IU Health. Pretty soon he wants to bring his pediatric nurse and talk about pediatric children on dialysis and the ins and outs of that. Dr. Patrick G, PhD, Dr. Patrick G wants to come on and talk to us. He's not only a PhD, he's also a minister. He has a very unusual kidney transplant story. It's about a sleepy kidney and a delayed graft response. For a long period of time, for a longer period of time than normal. So that should be very interesting too. So, watch this space, my friends, and we will talk soon. Everybody have a good evening. I have to send Steve to bed. Bye-bye.
Thank you so much, Jim.
Oh, you're welcome, Ms. Valen. Thank you.
Brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cody's brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta ride or die.